Hi, in this video we'd like to go into a much more controversial recent topic on the process of induced abortions. We know that in the States there have been new laws being introduced that's prohibiting these types of practices. And today we'd like to discuss a bit from a medical aspect, from Antai Hospitals aspect, on why it is still necessary for the sake of the mother as well. So there are certain exceptions, certain scenarios that will require an abortion. Now, we are looking at certain extreme cases, sometimes in rare cases, some certain medical conditions that will require abortions to protect the mother's life, because that is our first most and also our utmost priority, which is to preserve maternal life. Now, at Antai Hospital, within the past 2 decades of treating and contributing in women's health, the number one most deadly pregnancy disorder, most life-threatening disease that we've observed is known as Hyperemesis Gravidarum. Now, before Antai Hospital has discovered this treatment, since we do provide treatment now, so we won't need to go for abortions anymore, but in many parts of the world, there is still a lack of awareness for proper management, proper treatment of Hyperemesis gravidarum. And this rare pregnancy disease is so severe that it can push the mother's life to the brink of the edge. It can really cause some maternal morbidity, and it can severely affect their mental capabilities in terms of thinking clearly, in terms of having a clear mind. They're all very depressed, extremely anxious, because they are under constant stress because of how severe this condition is. Not only does it affect fetal development, it can cause fetal death as well. And it can certainly lead to maternal death. And in these extreme scenarios, where there are no options of management or proper treatment, in especially most parts of the world, where they cannot effectively manage the condition, it just gets worse and worse and worse. And this condition will last the entire 9 months of pregnancy. You can imagine how much stress and how painful, how torturing this condition is. And the only way to terminate it, besides treatment at Antai Hospital, which is our HCG desensitizer, the only common approach is to go for an abortion. Immediately after abortion has been conducted, HCG immediately drops over the next few days. Symptoms start to slowly dissipate, and the mother's life is secured. She starts to recover, she starts to gain her weight, appetite, hydration, all her electrolytes, and because an abortion saved her life. So in extreme cases, we still believe that abortions should be necessary in the case of preservation of maternal life. Another case that still requires abortion is fetal abnormality that can happen during pregnancy. Fetal abnormality is usually caused by environmental factors or internally, externally, or whether there's some form of extreme chromosome mutations that will lead to a deformed fetus or a deceased fetus in the midst of pregnancy. And in these types of cases, we still need to go for an abortion to actually do some analysis on the fetus to make sure that the next pregnancy we can actually stop it. Because at the end of the day, we want to secure a healthy full-term pregnancy, and we want healthy children as well. So these two are certain scenarios that we can consider still allowing abortions. And another thing is, although abortions has its bad reputation, it is in fact a cause for another common reproductive disorder, which is known as recurrent immunological miscarriage. Now, at Antai Hospital, we do provide an internationally patented treatment for this condition, and we have identified that the main cause is in fact induced abortions because of the several induced abortions that a mother has experienced to terminate the pregnancy. Certain pregnancy tissue enters into the mother, causing the development of certain antibodies known as anti-embryonic antibodies, and these antibodies stay in your body and they begin to target the embryos, the pregnancy in your subsequent pregnancies. So you will experience repeated pregnancy failure, and the root cause is because of induced abortions. Now, we're not saying that induced abortions is not allowed anymore because we want to preserve life. We still believe that there are certain necessary scenarios that require it, and it can cause harm. But there's a proper way to do it, because induced abortions is if not done properly, it can lead to severe complications. For example, for women who have multiple induced abortions, it's very common that they will develop Asherman's syndrome, where the uterine cavity begins to develop several scar tissues that are web-like structures, adhesions, and this can lead to infertility. So it ends up these types of patients cannot get pregnant anymore. They cannot have their own child anymore because of numerous attempts of scraping, removing the inner lining of the uterus, damaging all the structures of the uterus, and then it ends up becoming something that is difficult to treat at that stage. So although induced abortions, if done correctly, it still has a risk of potential complications. At Antai Hospital, we only recommend induced abortions via the most effective and safe way, which is via hysteroscopy. Hysteroscopic induced abortions is considered one of the most safest ways of terminating a pregnancy because it gives a surgeon direct visualization. We are looking directly into the cavity and we can pinpoint the location of the pregnancy, remove it carefully without shattering, so there will be no antibodies forming into your body, in your system, in the perspective of the mother, and we won't be causing any scarring, any damages, any bleeding, because we only remove the embryo. We are not blindly scraping. Although it does have an increased expensive cost, it's still something that you need to consider if you want to have longevity in your fertility. You still want to have subsequent pregnancies and you want to preserve your uterine health. So in conclusion, induced abortion is still something that's very necessary but must be done with the correct technique, as we've discussed, using hysteroscopy. And prohibiting these types of practices, medical practices, will only introduce it to it being done much more dangerously, much more illegally, and then it can cause much more severe complications. As I've mentioned, it can lead to immunological RSA, it can lead to Asherman's, it can lead to infertility. And if it's not done by a legal professional, it can be catastrophic, very damaging to the mother in terms of longevity, fertility, and it may potentially lead to maternal death as well.